Mr. Ledford? Yeah, could you hang on one sec, please? Yep. Mr. Hewitt, you have interrupted 4 people. You are off the comment list. Thank you.
Thank you very much, guys.
Mr. Ledford.
Good evening. Thank you for hearing me tonight. I do have 2 children in the Bristol Warren School System. We are from Bristol. As most parents, I want to protect my children as best as I can. And I am concerned about the pending mask mandates. I want to give my children the tools to grow up be good stewards to the environment, be kind to others, successful and future leaders for generations to come. While in school, I believe it is their right not to have their learning process hindered, physical or mental well-being negatively impacted. There are studies saying that cloth masks help stop the spread of COVID, and there's others that say they don't. Healthy children under the age of 18 are extremely low risk of serious illness from COVID-19. Less than 1%, it's actually closer to 0. Most that contract the virus have mild or no symptoms. Over 9 times as many children die from accidental drowning every year in the US than have died from COVID total. That's on the CDC website. According to the latest numbers from the CDC, 0.05% of all COVID fatalities in the United States are children under the age of 18. Totals 423 deaths. I'm not making, I'm concerned about everybody, but I'm saying compared to the 3,960 deaths from drowning, we have to look at this and, make the choice based on the people in the community. My question to all members of the community, how come it's become the job of our children to protect the adult population? In my mind, the adult population should do what's necessary to protect themselves without affecting the well-being of our children physically, mentally, and academically. Mass deprives our children of oxygen, causing brain fog, confusion, which hinders the learning process. You guys wouldn't have mask breaks if it didn't. I actually work physically. I've tried to work out physically, and I get dizzy and can't think. So there's no way that the study says that doesn't happen. Wearing a mask can also change social interaction, causing children not to read and see facial expressions, which hinders how they'll respond to social cues. The community would be better served by allowing our children to have normal childhoods without mandates being forced upon them that will affect their learning process, long-term mental and physical health. Last year, mental illness did pick up in the teen population, as well as teen suicide. There is data on that. I do think it would be in the best interest for the school systems and all public buildings to do more air filtration, install the systems that kill COVID-19, the air purification, and I strongly disagree with the mandate for our children to wear masks or any other mandates that could have negative outcomes for our children. Parents should have the choice. We want to protect our children from the virus. They are at such a low risk of serious harm.
Thank you.